Hello, welcome to Sowing Our Seeds. On this class, we're going to do a little bit of an introduction, explaining a little bit more about infertility and functional medicine and what to expect. What are we going to be addressing as far as functional medicine in this program? So, infertility, as you probably heard me saying before, is on the rise. As of 2023, 1 in 6 adults of reproductive age are considered infertile. Male and female factors are responsible for infertility almost equally. So it's basically 50-50%. I think we have a tendency to think that women usually, when couples are not being able to conceive, most of the time we think there's a problem with the woman, but that is not true. It's a 50-50 chance almost. But the good news is that infertility is a rare condition, and most of these couples, they are not infertile. They are in a subfertility category. So there's a lot to be done to move them to the fertility category. One thing that I like to emphasize is that subfertility is not just a hormonal problem. It is a red flag that your body, your overall health needs attention. And there are studies that show that infertility is linked to lower life expectancy in men and women and increased risk of certain diseases. So when you are going into this course and you are participating and you are changing your health, you are giving yourself, you are extending your life. Everything that you do to optimize your health, you are talking about extending your life. This is a beautiful gift. So it's not just about upgrading our fertility, but it's biohacking your health. Doctors give the diagnosis of unexplained infertility when they can't find any reason why the person is not being able to conceive, but they do that without going deeper, without digging into individuals' health and understanding the root causes of it. They just look for the basics. Fertility health should be a priority at least 6 months before couples start trying to conceive. That would avoid a lot of frustration. The definition of infertility is the absence of conception after 12 months of regular, unprotected intercourse. And if you're 35 or older, they will lower to 6 months. In Western countries, the sperm count and testosterone levels are declining a lot. As you can see, sperm count declined 52% between 73 and 2011. 2024, I don't even know where those numbers stand. And women are experiencing puberty earlier and higher rates of miscarriage. I also see in my clinical practice a huge number of PCOS, endometriosis, myoma, and all of that I think is related to our lifestyle, our modern lifestyle. With the last century, we changed so much, and our bodies are not being able to catch up. I believe eventually, in 100 years from now, maybe we're going to be caught up with all this modern hacks that we created in our lives, but our bodies are not really fully ready. And the first thing it shuts off is procreation because it's scared. It doesn't know if it should be procreating in an environment like that, right? It doesn't feel safe. Prenatal care is incredibly important, and that's why I say that everyone should prepare. But unfortunately, we don't have that knowledge. We don't understand that we should be taught this in high school or anyone getting married or whatever. We should be taught that before conceiving, take 6 months to prepare. Take a year to prepare your body because it's not just about getting pregnant, but it's conceiving a healthier child, right? So prenatal care increases the chance of conception, decreases the amount of frustration and mental emotional stress, pregnancy complications, gestational diabetes, preeclampsia, reduces the risk for childhood disorders, obesity, allergies, autism, It optimizes postpartum recovery and reduces the risk of postpartum disorders like autoimmune disorders, depression. So it has, it's a very important aspect of your plan. And I'm very proud that you decided to start this program today. And if you're ever feeling a little bit discouraged, go back to this lecture to remind yourself why you're doing this, right? It's a good motivation. Time is a factor. We all know that there's a fertility decline with advanced age. And there is a misconception that high technology is the best, sometimes only choice, and holds more guarantees. A lot of times conventional doctors are going to say the only thing you can do is go through an IVF. That's your only chance. And considering that IVF success is about 50%, it's a little bit like I don't even know how they recommend that so emphatically, you know. But the reality is that sometimes a simple strategy can give you, can be incredibly efficient. And that's what we're going to do here in this program, give you tons of simple strategies. We are educated that getting pregnant is really easy, right? When we have sexual education in college or at home, we are all told, be careful, you can get pregnant, you have to be very careful. But the reality is the probability of each menstrual cycle is only 30%. So each month, if everything is fine with you, 30% chance that you'll get pregnant. And only 60% conception advanced beyond 20 weeks. But don't get too nervous. You're going to think wow, 40% miscarriages. A lot of those are chemical pregnancies, right? So you don't even realize that you were pregnant. So the traditional approach is for females, they check the cycle, they check the ovulation, they do hormonal testing, they do anatomical analysis, right? They're going to check your uterus, your tubes, make sure that there is no scars or the tubes are not closed. And then they're going to, based on what they find, they're going to prescribe a medication without asking, what is the cause of this problem? Why are your hormones imbalanced? What is causing your body to be like that? And they're going to tell you sometimes, just try it for a year, go on vacation, have fun, come back in a year. Without maybe in this whole entire year, fine, you can just try for a year, but let's do things that are going to put you closer to your dream, that are going to, avoid frustrations. Because if you're trying for a whole entire year and there's one piece of the puzzle missing, you're not going to get anything. And then after a year, you're a little older, you're already super frustrated, your mindset, your morale probably are low. So, and then they give you the unexplained infertility and then the magical words let's do IVF. And then for male, they will do the semen analysis. They will prescribe medication, again, without questioning what is causing the problem. And unfortunately, conventional medicine uses a one-size-fits-all approach. So you have these labs. This is the recipe for you. Basically, it's just prescribing. Is not, they're not finding root causes. They are not working with each individual, each couple, and understanding what's happening. On the other hand, functional medicine holistic approach focus on addressing the underlying root causes of fertility rather than just simply treating symptoms. This approach is recognized that fertility is influenced by various interconnected factors, including hormonal balance, nutritional status, stress levels, environmental exposures, and overall health, well-being. A comprehensive assessment is put in place where practitioners take a comprehensive look at individuals' health history, lifestyle factors, environmental exposures, genetic predispositions, and they identify potential imbalances or dysfunctions that may be impacting fertility. They focus on personalized nutrition. So nutrition plays a crucial role in fertility, and functional medicine practitioners often emphasize a nutrient-dense diet, tailored to each individual's need. This may include foods rich in antioxidants, vitamins, minerals, and healthy fats to support the reproductive health and hormone balance. And then there's another approach where your practitioner will say, limit this type of foods. Your body doesn't do well based on what I see. I think you should try this strategy of like eliminating certain foods, right? So it's a more personalized approach. It will focus on balancing hormones because hormonal balance can significantly affect fertility. Functional medicine practitioners may utilize hormonal testings to assess levels of estrogen, progesterone, testosterone, thyroid, and other key hormones involved in reproductive function. And then they will like create treatment strategies that may involve lifestyle, nutrition, supplements, botanical medicine like herbal medicine, and maybe sometimes hormonal replacement therapy. Stress management is really important because chronic stress can disrupt hormonal balances and negatively impact fertility. We're going to talk on other lecture later how our thoughts, like not just the stress, but even our thinking can affect our hormones. And fertility is all about hormones. And then holistic approaches emphasize stress management techniques such as mindfulness, meditation, yoga, relaxation exercises to promote emotional well-being and support the body's natural fertility mechanisms. So it's a whole mind-body approach, right? It's not just simple little quick fixes. And then if they are going to work on detoxification and environmental factors, so functional medicine practitioners recognize the impact of environmental toxins on reproductive health and uses strategies to reduce toxin exposure, maybe dietary modifications, avoiding harmful chemicals in personal care, household cleaners, supporting your body detoxification pathways through target supplements and lifestyle changes. Very important too in fertility. And optimizing lifestyle factors, right? Because healthy lifestyle habits such as regular physical activity, adequate sleep, very important. Sleep is incredibly important. Healthy weight, avoiding excessive alcohol and caffeine. All those things are essential to optimize fertility outcomes. And as I said before, they are functional medicine practitioners will work with individuals to implement lifestyle modifications that support their overall health and fertility based on each individual's needs and challenges and whatever they investigate in the beginning. They will create a plan. So that's what we're going to do. And they focus on mind and body connection, as I said before, like what your thinking influence your body, even your hormones. So holistic approach is a knowledge that the mind-body connection and influences fertility and uses strategies to reduce stress, enhance relaxation, and promote a strong positive mindset towards conception. And we're going to have little classes here to emphasize that, give you tools to do that. That is very crucial. And then there is a collaborative care. Functional medicine practitioners often are going to work closely together with other healthcare providers, like reproductive endocrinologists, naturopathic doctors, acupuncturists, mental health professionals, just to kind of like involve everyone, get everyone together. Is almost like the connection of, amongst all the other parts in the game. There are some important factors for fertility health. One must, almost like a checklist that we need to identify. We have to have a healthy menstrual cycle and ovulation, healthy cervical mucus, healthy vaginal microbiome and pH, healthy sperm, right time of intercourse. Believe it or not, there are people that are just doing it on the wrong time. There's a compatibility sperm egg that is very important. Some people that there need to be hormonal balance, immune balance, a positive strong mindset, proper implantation, and placental development. All those things need to be in place for you to have a successful pregnancy. And of course, behind everything that is on this list, there's hundreds of other factors that influence that. There's hundreds of factors that influence sperm quality, egg quality, the cervical mucus quality, immune system quality. So all of those behind the scenes is what we're going to be investigating and working here on regular basis. And the main causes of infertility is menstrual cycle factors, egg health, sperm health, and anatomical factors, hormonal factors, environmental causes, autoimmune disease, diet, blood sugar regulation, obesity, stress, emotional blocks, very big. So by addressing the underlying factors contributing to fertility challenges and supporting the body's natural healing mechanisms, functional medicine and holistic approaches aim to optimize fertility outcomes and improve overall reproductive health and well-being. As Einstein said, I always like to say this, and you might have heard from me before, we cannot solve a problem with the same thinking we used when we created them. So if you're already experiencing infertility for a few years, it's time to change something, right? To improve. If this strategy is not working, or if this strategy is what caused the infertility, then we have to remove it and create a new strategy. So here I'm going to give you a lot of information where you can improve not just your fertility, but your health and become healthier. And these are going to affect your life, your long-term life, and even your offspring's life, your kids' life, because everything that you're going to learn in this program, if you keep applying, you're going to give the gift of a healthy life to your kids, to your family, and to yourself. So I'll see you in the next class.